What is chimerism versus Mosaicism in bioethics? Imagine living in a body that's made up of different sets of DNA. That might sound like science fiction, but it actually happens in real life and raises important ethical questions. Today, we're exploring the difference between chimerism and mosaicism, especially in the context of advanced medical technologies, cloning, and stem cell research. These phenomena are more relevant than ever as scientists create new ways to treat diseases and even grow organs. Chimerism happens when a person has two or more groups of cells with different DNA, coming from different fertilized eggs. This can happen naturally, like when two embryos fuse early in development, or artificially through procedures like organ transplants or stem cell therapies. For example, a person might have blood cells from a donor or tiny amounts of foreign cells from pregnancy. This means their body contains cells with different genetic codes, which can make identifying their true genetic makeup tricky. Mosaicism is different. It occurs when a mutation or chromosomal change happens after fertilization within a single fertilized egg. This creates a mix of genetically different cells, but all still originate from the same original zygote. Think of it like a patchwork quilt, where some patches are different from others, but they all come from the same fabric. Mosaicism is quite common and usually involves only certain parts of the body. It doesn't usually cause identity issues, but it can impact diagnosis and treatment. In bioethics, these differences matter a lot. Chimerism challenges ideas of personal identity and bodily integrity because a person might have cells with different DNA. This raises questions about consent, especially if some cells carry genetic information that could reveal sensitive data. It also influences how we think about organ transplants, as matching donor and recipient becomes more complex when chimerism is involved. Mosaicism, while genetically complex, generally doesn't cause the same level of identity confusion. Still, it can impact medical decisions, especially in genetic testing or prenatal diagnosis. For example, if a fetus has mosaicism, it might be mistaken for a genetic disorder or vice versa. When it comes to creating chimeric organisms, especially those combining human and animal cells, ethical concerns grow. We need to consider the moral status of these beings, their potential suffering, and the implications of mixing genomes. These issues tie into core principles like respect for autonomy, beneficence, and justice. For instance, ensuring informed consent for patients involved in stem cell or chimeric research is vital, along with minimizing harm and making sure therapies are accessible to all. Understanding these phenomena helps us better navigate the ethical landscape of advanced medical technologies. It guides us in making responsible choices about creating chimeric organisms, using stem cells, or cloning. These advances hold promise but also requiring careful ethical consideration to respect human dignity and animal welfare. So, in simple terms, chimerism involves different DNA lines from separate fertilized eggs coexisting in one person, while mosaicism involves genetic differences arising within the same embryo. Both raise important questions about identity, consent, and morality as science pushes forward into new frontiers of medicine.